Lisa, you're here today after your surgery, right?
Right.
So, the reason why I'm doing this testimony is because obviously this is not your first surgery you've done with
No.
me. So, how many surgeries have you had?
I had my tenotomy with
Uh-huh.
you on my little
Uh-huh.
toe. You took all the nasty hardware that was broken
Yes.
out of my foot,
Uh-huh.
which probably saved my life. And then I had got this the toe amputation done.
So basically, you've had some previous surgeries done, not here, not at this clinic, but somewhere else,
That is
right?
correct. I had some
And
back in Indiana.
in Indiana, and unfortunately, you had some pretty major complications, and you had a MRSA infection there, right?
I did.
And then when I went back to remove your broken hardware, and this is what we call it, because
Right.
remember how it was in multiple pieces, we found out that it was really not in the best of shape.
No, it wasn't.
Right, right. But the reason why I'm doing this testimony, I want to really be on a positive note. Um,
Yeah.
so basically, going through all the three surgeries, and I know some of them were very straightforward, and some of them were pretty simple. Do you think, from the customer's standpoint, do you think that we were up to par in terms of your expectations and in
Dr.
terms of?
Wellens, I think you're above par.
Oh, thank
I
you.
have no qualms about saying that. I think your reputation is above reproach, and your staff here is wonderful, and I have only high praises for you
Oh,
and your
you're so
staff.
sweet. Thank you. Well, you've been a great patient. That's why actually your testimony is very different from any other testimonies we do, because usually it's more on a surgical procedure and everything
Right.
else. But I think that the reason why I'm doing it is very simple. In healthcare nowadays, it seems like everybody is a number and nobody is a human being. And I think that healthcare in general is really losing the touch of personalized attention and personalized, um, healthcare, which was always a pride of the American system, right?
Exactly.
So I think that there's nothing wrong with going back into this personal space to where patients know doctors and doctors know patients. So when you call me in the middle of the night or something is going on, I know exactly who you are. I don't have to go into my electronic medical records and actually
Right.
look you up. But you've been a really sweet patient, and thank you for referring your husband to our clinic.
Yep.
So I'm sure we have many more years together.
Oh, yes.
We'll retire together,
Absolutely.
right?
Absolutely.
Good. Thank you so much.